Hi there, I'm Dr. Mike, Director at Elite Spine Centers. Today we're just going to take a few minutes and go through some of the common reasons that many people may come in with neck pain or back pain. Actually, you might be sitting on your computer right now feeling some of those problems yourself and wondering, why do I have these? It's a common question we get quite a bit. Frankly, we can break down some basic reasons that people tend to get these problems. Often people might come in and ask me, oh, hey doc, is this a bone problem or a muscle problem or a joint problem? The answer is not always so simple as just naming off one thing. So often we're educating our patients of the multiple or sometimes complex reasons that they might actually develop these problems. So for example, bones, muscles, joints, nerves, tendons, ligaments, all these different tissues you have in your body, they're all working together to help you move and do the things you do day to day. The problem is most of us don't really appreciate how we use our body every single day and how problems may then develop over time, which is actually why the majority of people end up coming in with their problems. You know, let's give you an example. Maybe I have a patient comes in, 30s, 40s, he bends over to pick something up off the floor and then, oh, he has a back pain or his back goes out, and we hear that a lot. Picking up a pen off the floor didn't damage your back or your spine, but it may have triggered or activated a problem that could have been building its way up over many months or even years in some cases. So that's really what a good chiropractor should be doing for you, is analyzing your whole situation, both mechanically, how you're moving, what your daily habits are, your routines, and what might actually be causing these issues to build up. So some patients may be wondering, like, what are the types of pains or problems you could be feeling? So this could really vary a lot depending on your age, your lifestyle, what are the common activities you do. So some of the simple stuff we see a lot is people just saying, oh, it's not even pain, it's just, discomfort or sore, or my Chinese patient, suan tong. So they might get all these things happening, which is very common, right? But just because it's common doesn't mean it's normal, right? So just because you've been living with something for days or weeks or even years doesn't mean you should. Or just because a lot of people deal with this problem doesn't mean they should. So these are things to watch out for. Your body is giving you clues or signals of things that you should be paying attention to before it might get worse. Because then, we'll get people maybe a little older, they've been pushing this off and pushing it off. And then one day they reach to grab something, and then all of a sudden they have a sharp shooting pain down their arm. Or they might start getting numbness, tingling into their fingers. Or same thing, could happen down your butt into your legs or into your feet. So these types of shooting pains, or what they call radiating pains, these are often signs that the nerves or sometimes even the discs in between the joints may be getting involved. And if that starts to happen, this may be a sign that the issue's been building for longer and it's reached a stage of being more serious. So that's really what our job is trying to determine not only where the problems are, what's the likely causative factors, again, muscles, tendons, ligaments, nerves, bones, all these different things, and also how long they've been there and how serious is the problem. And this is really what you need to figure out before you develop a strategy of how to correctly tackle the problem. So now, if we've analyzed the patient and figure out what's going on, why they're having their neck or their back pain, I'll run you through maybe a possible scenario just to explain a bit of what we do and how we help these people. So, let's imagine we take a patient, maybe she's a late 20s, office worker, doing the usual things, sitting at the computer all day. One of the things we look for is the structure or shape of the spine when we're analyzing. So oftentimes we'll start to see where people's structure will start to shift forward. So we start to get a forward posture shift, or anterior head carriage, it could be called. So the head, the shoulders, everything starts to round in. This starts to put more pressure on the joints, the tissues of usually the lower cervical, which is the neck, and the upper thoracic, which is this upper back section. So this is where people first may start to get, I just get always tight shoulders, I go to the massage and they say, my muscles are always stiff. This may be true, but is it just a muscle problem, or are those muscle problems developing because of other conditions? So for example, structural changes, maybe alignment issues, or what we call mechanical problems, where maybe some of these bones or joints are not moving the way that they should. This is then going to impact the nerves in these areas, and the nerves also affect the muscles. So you can start to see how just my shoulder muscle problem may have many components going on, and why we need to address it from many different ways. So that's really why we kind of created this FCM method that we use, which kind of addresses not just bone alignments and cracking the spine, which is nothing wrong with that. It helps people feel better. gets more mobility in the joints and tissues, which is needed. But we also have to teach them rehabilitative strategies of how to start fixing their posture, maybe giving them homework to do at home, lifestyle advice, how to set up their computer monitor at work or at home. And all these things will add together to really help them rehabilitate the problem, and so they don't have to live with it as they get older and down the road. So if you're wanting a couple of things that most of us can do to help this type of a problem, it's very simple. First, watch your posture. So every time you catch yourself playing your handphone or on the computer, see, is your head drooping forward from your shoulders? Are the shoulders rounding in? Very common to see this. So first thing is just pull your spine up into an elongated position. This will naturally pull the shoulders back, pull the head back. That's instantly going to give most people a little bit of pain relief. Of course, if these things have been sitting there for a long time, you have chronically tight muscles, we have certain stretching exercises and things that can help. So I might suggest you go ahead and take a look at our channel. We actually already have some exercise videos put up for simple neck stretches, back stretches, etc. So go ahead and take a look at those. Those will be easy for almost everyone to do. Another thing is your workstation. So after the CV last year, I know many people in Singapore have been coming in with more agitated problems than they had when they were working in their office. Many times this is due to a poor workstation setup. So we actually have another video on our channel that talks about computer workstation and how to set that up properly. So you may want to go and take a look at that as well. Even things like your monitor height, like if you're working on a laptop, many people have to sit, again, looking down at the laptop with a hunched position. If you're doing that for 5, 6, 7 hours a day, 5 or 6 days a week, you can see how that adds up as well. So again, simple things like that are going to help to give you a lot of relief to start out. So like many people out there, you might have been pushing off some of these problems for a while, or just dealing with it and just saying, it's not a big deal. Or maybe it is starting to affect you a bit more and you're wondering what you should do. So of course the things we mentioned as far as stretches and posture and so forth, these will definitely help you. But for most people, it's not really going to get to the root of the issue or help them solve it for the long term. So what people really need, in my opinion, is education and a system. And a system of how to analyze their body, know what's going on, what are the steps they need to take, and the length of time they should expect to take it to really reach those next levels of improvement. So that's really what we suggest for people, is to find a qualified professional who can give you this type of system, give you good hands-on treatment if necessary, but also the right lifestyle recommendations. So that's really what we do, at Elite Spine with our FCM system, is try to, again, not just be another therapy or a way to get out of pain quick, but really teaching people how to take care of themselves and their health over the longer term. So if you liked this video and the type of information that we're sharing, please like it, share it with your friends, subscribe to the channel, and we'll be happy to put out more of this down the road. Also feel free to comment if there's any types of topics or information you'd like to know more about. We're happy to help you in your journey. So thanks a lot, Dr. Mike here from Elite Spine.